Good morning, and welcome to Ram City News. I'm Sabrina Coronado.
And I'm Michael Bencomo. In today's episode, we'll be focusing on the safety needs of the older adult.
The elderly population is at an increased risk for falls. Here are a few tips to decrease your loved one's risk for falls. If you are taking antihypertensive medications, please be sure to rise slowly from a sitting or lying position. Rising too quickly can lead to dizziness, which leads to falls. Keep walkways clear of clutter and always keep them well lit.
Assistive devices are being used more and more for this elderly population. Misuse of these devices, though, can lead to serious safety risks. When rising, use the arms of the chair. Do not pull down on the walker. And also, recent studies have shown the use of tennis balls on walkers harbor bacteria and can contribute to falls due to deterioration.
So Michael, remember, keep those balls on the court, not on Grandpa's walker.
I'll sure try to do that, Sabrina. This just in, a well-known propane vendor in the Fresno area was just admitted to an area hospital due to a propane explosion. We now go to Jennifer Lima on the scene.
Yes, thank you, Michael. I'm here at Ram City Hospital with Hank Hill, who just survived the propane explosion. Mr. Hill, can you tell us what happened?
Yeah, since I moved to Fresno, I've had a decreased sense of smell due to my involvement in a prior propane explosion.
Wait a minute, you mean this happened once before?
Unfortunately, yes. I've been involved in multiple explosions.
Huh, okay. So what happened this time?
Well, I had moved all my propane and propane accessories into my garage, and due to my decreased sense of smell from getting up there in age, I was unable to detect the propane leak.
Well, and then there was another explosion. Let's go ahead and take a look at some video captured by a neighbor during the explosion. As you can see here, the propane started a pretty good fire. And although decreased sense of smell is normal in elderly people, this horrific scene could have been prevented with a propane gas detector. This is Jennifer Lima. Now back to you in the studio.
Thank you, Jennifer. And aside from those propane detectors, we also want to caution the public on also having carbon monoxide detectors in their home and also properly working fire alarms also throughout the house.
That's probably a good idea, but I can't stop thinking about that Hank Hill person. He looks so familiar, Michael. I don't know, I just feel like I've seen him before. Anyways, folks, we'll be right back with the weather.
These are real-life emergencies. They happen suddenly and unexpectedly.
Help! I've fallen and I can't get up!
Did you know 1 in 3 Americans age 65 or older will fall this year? That's too many. Introducing Fall Alert, alerting emergency response at the push of a button.
I was always worried about my mother living alone. What if she tripped down the stairs? What if there was a fire?
At first I was insulted. Then I fell in the shower. Fall Alert saved my life.
For just $14.99 a month and no activation fees, you can have peace of mind. Call 1-800-HELP-ME now.
Thanks, Fall Alert!
And welcome back to Ram City News. Now we go to Sabrina Coronado with that great weather forecast.
Good morning, Rams. I'm here with the weather. Today we have a high of 90 and a low of 57. And although the temperature is starting to cool down out there, we want to remember to stay hydrated, especially in our elderly population, as they're more prone to dehydration. And as we see here, the sun is starting to set earlier. Today we have a sunset at 5:40 p.m., which means we need to remind our elderly population to look out for children playing, especially as we get closer to Halloween here in the evening. Thank you, and back to you, Michael.
Now just in, a local woman has just died at a restaurant due to a medication error. Let's look at a video that you'll only see here on Ram City News. What you apparently see is that what the elderly woman is into some type of chest pain, and her friend is looking through possibly a medication bag where she, now that we know what's happened on the scene, that she possibly was given the wrong medication. We now go to Jordan on the scene.
Thank you, Michael. I'm here at Big Ram Restaurant where a 72-year-old woman named Laverne has died. After viewing surveillance footage, police suspect that Laverne's friend Shirley gave her digoxin instead of her nitroglycerin for suspected chest pain. Police just revealed this official statement from Shirley. I was in such a panic. I already knew Laverne had chest pain. I knew she takes nitro, but I've been losing my vision. I have cataracts, see? And I couldn't find my glasses, so I was looking and I gave her the wrong medication. I can't believe I killed my best friend. Live at the scene, Jordan Moreno. Back to you, Michael.
Well, for prescription safety, you should always ask your local pharmacy for either color-coded caps or large print labels for your prescriptions to help avoid medication errors.
And we now bring you today's special top story, when to have the talk. The talk about taking away driving privileges.
Do you notice your mom backing into things? How about speeding up when meaning to slow down? Driving 40 in a 60? How about your dad taking up 2 parking spaces instead of just 1? Maybe it's time to have the talk. The talk about handing over the keys. The very old may not be public enemy number 1, but they are killing more people than ever before. Even more so than teen drivers. The CDC reports that an average of 500 older adults are injured every day in car crashes. Also, fatal crash rates increase after the age of 75. Age-related decline in vision and cognitive function may affect some older adults' driving abilities. Older adults can take several steps to stay safe on the road. Exercise regularly to increase strength and flexibility. Ask your doctor or pharmacist to review your medications to reduce side effects and drug interactions. Have your eyes checked by an eye doctor at least once a year. And wear your eyeglasses if needed. Drive during daylight and good weather only. Find the safest route. Leave a large following distance behind the car in front of you. Lastly, consider potential alternatives to driving, such as riding with a friend or taking the bus. However, if you or your loved one are beyond any help from these tips, there are a few more options. The Department of Motor Vehicles offers a re-examination of any licensed driver whose driving ability is scary or becoming scarier. To have someone anonymously called in for re-examination, write in about their declining driving skills to the local DMV branch. Re-examination of a driver can involve taking a written test, driving test, and, or if needed, an eye exam. Afterwards, DMV will make a decision based on how dangerous the driver has become. If an action is taken, it could be a restriction, probation, suspension, or revocation. If one's license is revoked and you don't want to ride Fresno's buses, an option to consider is one called Taxi Script. The Taxi Script program is paid for by Measure C, and anyone over 70 years of age is eligible. Taxi Script is a coupon book that provides a 75% discount on taxi rides from many different local taxi companies. For more information on Taxi Script, please call 559-233-4148. And for more information on when driving is no longer safe, please contact your local DMV. I'm Jennifer Lima. Now back to you.
Thank you, Jennifer, for that special report. Wow, Michael, do your parents still drive?
Sabrina, my parents are 50 years old. Of course not. They do not drive anymore. That's crazy. It's ludicrous. We'll be right back.
I used to be embarrassed that I had to wear dentures, but now I love them and I want to make sure they last as long as possible. That's why I use FizzyDent to keep my dentures clean.
FizzyDent, available at your local retailer.
Now for some quick tips for your health. As far as hearing aids, you guys, elderly or anyone who's using hearing aids, you want to always make sure that they're properly functioning by checking your batteries all the time, checking that you can use the volume, that the volume works up or down, and also the most important thing, to make sure you have the right size hearing aid that you're using. That's always going to be for your optimal use and optimal hearing. You want to have the correct size.
And remember, those of you that wear dentures, please be sure that your dentures are properly fitting. A loose denture can harbor food underneath that you don't even know is there and can cause a pressure ulcer in your mouth. Also, please be sure to remove your dentures at night when you're sleeping. Don't worry, no one's going to see you while you're sleeping without your teeth.
And also a quick note, with the weather changing and the temperature getting a little colder out there, everyone, not just the elderly, are going to want to be taking those hot or warm baths. We always just want to make sure to let everyone know to always check the temperature before you get in the water, especially to be real healthy with our seniors due to their skin being a little thinner over the years. To always check that water before you get in and not to protect yourself from any type of serious burns or from not being able to feel that temperature correctly.
And for those of you studs who are taking the popular medication Viagra, remember to talk to your doctor about whether or not you can take it with your nitro, as taking the two together can cause a very low blood pressure. I'm Sabrina Coronado.
And I'm Michael Bencomo.
Thank you for tuning in. Have a good day. Michael, you're really good at this!
I know. I'm happy that you showed up.
Who would have thought?
What are you
Get that hair off of his thing, please.
Where?
Over there on his neck. There's a long hair.
Oh, see
I
it.
just see it.
Oh, I see it. That's a good one.
Is it?
Yes, that was way good.
Yeah, look at Sarah, look at Sarah. She's just like, whether she's eating or not, she'll get it. Look at her.